Hey El Paso, I'm Dr. David, physical therapist from El Paso Manual Physical Therapy. We got a question recently online from a woman who has seen so many medical providers, so many doctors, physical therapists. She's seen over 10 people, she said, and her biggest complaint was they all say something different. So her question was, how do I know what's going on inside of my knee so that I can know what to do about it? I asked her a bunch of other questions to get to the root of the problem. What I discovered is there's 6 big signs that you've got a cartilage problem. That's what we identified in this woman. So I want to share with you guys the top 6 signs that you've got a knee cartilage problem so that you know what kind of treatment to pursue. Sign number 1, pain when sitting too long. So if that knee's in a bent position, say you're sitting driving in a car, watching a movie, sitting at home, enjoying a meal at a restaurant, and that knee just starts to hurt and you get the feeling that you need to just stretch it out and walk around a little bit, that's a clear sign that there's probably some cartilage issue inside the knee. Sign number 2, so you've been stuck sitting for a while, then you go to get up and it's stiff. Stiffness inside the knee when taking those first few steps after sitting for a while is another clear sign that that cartilage inside isn't moving very well on itself. Sign number 3, clicking, popping, crunchiness inside that knee joint. That's not normal. A lot of people have it though, but it means that there's some problem with the cartilage because it should be nice and smooth in there. You shouldn't make any noise when you bend your knee. Some people, it sounds like they have Rice Krispies or sand inside their knee every time they bend it. Sometimes it gets irritated when they do that. Sign number 4, pain after standing for too long or walking too long. When I talked to this lady over Facebook Messenger, she was telling me that she can't stand for more than 30 minutes at a time. Going to the grocery store just leaves her in pain afterwards. Now, this is a bit more of an extreme example, but if you even find yourself having to sit down after standing for 60 minutes or walking for that amount of time as well, then that is not normal. You should not have any pain or discomfort in your knee if you're on your feet for 60 minutes. Sign number 4, swelling around the knee joint. Where your knee bends, where the lower bone here meets the upper bone, if it's swollen around there on the back, on the sides, or on the front, that is a clear sign that there is some sort of irritation going on, inflammation going on inside the knee joint. 9 times out of 10, cartilage is the culprit. And sign number 6, a family history of arthritis. If you've got parents or other relatives that have had arthritis problems already, then you're going to be way more likely to also have arthritis problems in your knee. Now, you may have even had an x-ray or some other sort of scan that showed that you have arthritis. Sometimes they'll say degenerative joint disease or decreased space inside the joint. Those are all kind of the same thing, and you bet there's going to be some sort of cartilage injury in the area. Guys, if you said yes to a bunch of these signs, I have those signs, yes, I have those signs, then there's good news for you. It is possible to avoid painkillers, avoid injections, and even avoid surgery if you put your knee in the right environment for that cartilage to heal. We help clients with this all the time so that they can get back to sitting as long as they want, walking and standing as long as they want, and not have to deal with any more swelling. If you have any specific questions for us, please comment below or send us a direct message and we'll be happy to answer it as soon as possible. Thanks guys, have a great day.